Diabetes increases the risk of death from other diseases, but most of what we know about those risks comes from high-income countries, where patients generally have good medical care and are able to control their blood sugar levels reasonably well. And in those countries, people with diabetes have been found to have about twice the death rate as people without diabetes. In many other parts of the world, however, diabetes control may not be so good, and the mortality risks from diabetes may be much worse. We did a study in Mexico, a large middle-income country, where obesity and diabetes rates are among the highest in the world. We recruited 150,000 men and women from Mexico City, interviewed them, took blood samples, and followed them for an average of 12 years. At the time of recruitment, more than 1 in 5 by age 60 had received a diagnosis of diabetes, and those with a diagnosis had, on average, very poor blood sugar control. Over the next 12 years, we found that those with diabetes had 4 times the death rate than those without diabetes. We then looked at the individual causes of death and found that the biggest excess risk was from kidney disease, followed by heart and other vascular diseases, infection, and diabetic coma. When these individual causes were added together, the excess mortality associated with diabetes accounted for 1/3 of all deaths between ages 35 and 74, which is twice what previous studies for Mexico have estimated. For the individual with diabetes, these results highlight the need for proper medical management, not only to control blood sugar levels, but also with other widely available, inexpensive drugs that reduce risk in other ways, such as reducing blood pressure and reducing blood cholesterol. In addition, our findings act as a warning to many other countries around the world where obesity and diabetes rates have been increasing, but haven't yet reached the levels seen in Mexico, about the potential health consequences at a population level of undertreating diabetes and its complications.